Hi there, my name is Jennifer Weiner, and this is my case study about self-care and resiliency to avoid burnout and moral distress. So my case study is on care and resiliency to avoid burnout and moral distress. We all know that nurses are at a risk for burnout. I think many of us have read literature about this and moral distress. And this is even more intensified in the midst of a COVID crisis. As of April, the count of COVID cases in the United States is up to 600,000, and there have been more than 25,000 deaths. In Wuhan, China, that's where the coronavirus was first reported, and a study looked at the medical professionals and nursing staff there, and out of 994 staff, they found that 36.9 of them had mental health disturbances after this crisis had come to a plateau in China. Nurses are more prone to higher anxiety and depression than other workforces, and we've seen a turnover, especially with our new nurse residents, that nurses are even leaving the profession in their first 2 years of working. So the recommendations from this case study are that nurse managers can provide staff with opportunities to build resilience through interventions such as self-care. So these are some of the key terms. Self-care are activities to promote one's own mental and or physical health and wellness. Resiliency is the ability to effectively and timely bounce back from stressful situations. Nursing burnout is feelings of being stressed, fatigued, overworked in the nursing profession. And moral distress is distress experienced by an individual when they are unable to carry out what they believe is right course of action because of real or perceived constraints to that action. And I think it's important to know that moral distress can occur from perceived issues. Sometimes nurses can feel staffing levels are unsafe, and this can cause them moral distress. And this could be because they just perceive them to be unsafe or that they actually are unsafe. So these are some of the concerns that nurses face that can cause burnout and moral distress. For example, nurses already feel stretched caring for patients, and these COVID patients take substantially longer time to care for due to both the heightened acuity of the patient and the donning and doffing of PPE, availability of PPE, charting and technology. While this is meant to help us, a lot of nurses can feel they spend too much time charting and they would much rather be connecting with their patients and coworkers. I do have a picture of a nurse looking a little exacerbated charting here. Violence and safety threats and concerns about compromising the care delivery also can cause nursing burnout. So from reviewing the literature, these are some interventions for nursing leaders to help nurses in this case study for self-care and resiliency, hopefully to avoid burnout and moral distress. I'll let you read those for a second. We'll go over them shortly. So I love this picture. We often talk about mindfulness in nursing, and this just gives you some activities that can promote mindfulness. Mindfulness has been studied a lot in the nursing literature. One study that I found was about a mindfulness workshop. This 4-hour mindfulness workshop was statistically significant and had a positive effect on reducing burnout and perceived stress in a Midwestern hospital, and they did post data at 1 month and 6 months post the 4-hour mindfulness workshop, and these elements remained positive. So in terms of self-care, developing self-care strategies can help improve physical and psychological well-being and reduce burnout in healthcare professionals. Self-care activities could include interpersonal connections, having a positive attitude, recognize one's own contribution at work, and just doing sleep, rest, or leisure activities. I thought that this was a fun exercise for self-care bingo that could be used as an activity in nursing. So I want to talk about some more interventions for nursing leaders. So developing a teamwork or mentorship program can help with nurse resiliency. Another activity that's pretty easy to implement is storytelling at nursing huddles. Just spending 90 seconds sharing positive stories can really have a positive influence on nursing. Employee assistance programs are also good, especially if someone really needs to dig deeper if a situation has been bothering them. You can use a team model to increase CNA support. I know we've done this with the COVID crisis to try to have more PCPs or staff available to be runners to help the nurses gather supplies. And I also did reference workplace violence as a threat against nursing. So you can implement a behavioral health emergency response team, or a BERT, to help with patients who are in crisis. So even though this is a huge problem, I hope that this literature can help provide you with some activities to use with nursing. So here are my references. Thank you so much for listening to this case study about self-care and resiliency to avoid burnout and moral distress. I hope everyone takes care. Thank you. Goodbye.